Hey, it's Dr. Blair. It's Tuesday, it's February 9th, and I was checking in today on my folks, but today I was going to talk about anxiety, specifically anxiety in pregnancy. Um, so, are you worried you might be anxious? Um, well, you're not alone. Approximately 1 out of 5 women meet criteria for generalized anxiety disorder in pregnancy, and that rate may actually be higher if you have a high risk pregnancy or a pregnancy complicated with medical problems. So, today I'm going to be sharing with you some um, high points from one of the articles that was sent to me by one of my friends, Martin Novak, called How to Manage Worry in Pregnancy. And I know it's going to be reversed here, but this is what the cover looks like. It's a very modern pregnant woman on here. But anyway, it's a really good article, and we've posted a link to the article on our website, so you can go there and find the article to read the full version. And I'm just going to highlight a little bit of the topics or the high points from the article. But anyway, it's pretty normal to be anxious or worried when you're pregnant. I can remember the very first night I came home with my first child, Jeb, over 13 years ago. And I got in the bed and I got him settled down in his little bassinet. And I was getting ready to go to sleep. And then all of a sudden it dawned on me, who's going to watch him while I sleep? And I don't think I've really stopped worrying about him since then. But it's really a common thing to be worried about a lot of things when you're pregnant. You might be worried about going into labor and what that's going to be like. You might be worried about how you're going to be as a parent, or you might be worried about how how you're going to function with so little sleep, or how this new baby is going to affect your marriage or your life, or all kinds of things. So it's really common and it's pretty normal to be worried. But when that worry starts really zapping the joy from your life, that's when we got to address it, because joy is important, and we need to not have all the stress and the anxiety that's going on in life. And so I think the article has a lot of good pointers about some strategies to take before we start medicine. And then sometimes we need medicine. Sometimes we need to take some medicine to help us with anxiety, and sometimes we need therapy as well. So, if after today you are having some questions about whether this anxiety is something that you can't handle on your own, that's not uncommon either. So make sure you reach out to us if we're your doctor, or reach out to your healthcare provider so that we can help you address your mental health, because that's something we do all the time. So some key points from the article are: one, just like I said, anxiety and worry are really common in pregnancy, and I mentioned the stat earlier that 1 out of 5 women actually meet criteria for generalized anxiety disorder during pregnancy, and it may be higher if you're high risk pregnancy. And two, we have to distinguish between productive worry and unproductive worry. I think probably we're a little bit more wired for anxiety during pregnancy because, handling a newborn and a new baby in the family takes someone that's on kind of high alert, because there's so many things that can go on and it's a new change. But some of that can sometimes lead to a little bit too much anxiety. But a productive worry is like when we are planning, when we worry about something that could actually happen that we need a good plan for. And an unproductive worry is, let me give the right definition, is worry about events that are not likely going to happen in the near future, or at least have a low probability for occurring, or things that are out of our control. And I'll give you a good example of this. I was staying at my sister's house for the first time after I had both of my children. I had my youngest there as well. She has a great guest room. It's upstairs, it's kind of away from everybody. And I was getting ready to go to sleep, and I had both kids up there and gotten everybody down after visiting with her and her family. We were all getting ready to go to sleep, and everybody was down, and it was that peaceful time of the night when you finally put your head on the pillow and you're trying to go to sleep. And then all of a sudden I had this fear: how was I going to get everybody out from that upstairs bedroom if the house caught on fire? And I had no clue how I was going to manage to get both children out and the dog out of the window and onto the ground safely. Now, granted, I had a husband but I didn't think he was going to help me in my little brain at that moment, but how I was going to get everybody out. And so I couldn't sleep until I had a plan, and it was a very elaborate plan. It involved sheets and knots, kind of going on in a crazy thought process. And so it was a productive worry at the beginning, because you need to have a fire escape plan wherever you are, in your home or at a guest or at a hotel or wherever. You need to know what you're going to do in the event of a fire. That's a productive worry, but it very quickly turned into an unproductive worry when I could not put it out of my head and go to sleep. I couldn't formulate a good plan. And so those are examples of unproductive and productive worries. So the article suggests some cognitive behavioral techniques to help you address unproductive worries. So it says, one, challenge how likely is it to happen? And if it does happen, in the worst case scenario, how are you going to cope? So the next morning I got up and immediately said to my husband, I was like, Gordon, I couldn't sleep last night. I thought, what if we had a fire? How are we going to get the kids out? He immediately looked at me and he said, well, I'm really tall, so I'll just hang out the window and drop down. It wouldn't be that far. And I just pushed the trampoline over, and we just get everybody out that way. It has a big net around it. I think we could probably drop everybody down and we'd be okay. Well, that would have been nice to know, like early into my sleepless night. Because that would have been a reasonable plan. So you could talk to people about your concerns and get a reasonable plan, and then know, one, it's not very likely for that fire to happen, but then have a reasonable plan for a worst case scenario. So talking out with family members or friends your concerns, or even a therapist if you don't have people to help you kind of talk out those kinds of things in a reasonable manner, that can be helpful. So it also talks about worry behaviors, because sometimes, I just talk about it too much. We constantly seek reassurance, and that actually, makes our anxiety worse. So we ask for constant reassurance, or we're constantly checking the internet for our medical symptoms and going on. And these worry behaviors, you'd think they would help reduce anxiety, but they actually make it worse. So the article suggests to try to replace worry behavior with things such as self-care, social support, and relaxation. Go for a walk, do meditation exercises or deep breathing, or schedule a prenatal massage. Any excuse to schedule a prenatal massage sounds good to me. And then you can also schedule a therapy session with a psychologist to discuss some of the things that are going on. So these are just some high points in the article, and it's jammed full of information which might be helpful to you. And so I suggest, if you're worried you might be anxious, to take a look at the article and check it out for yourself. And again, if these are some concerns you have and you think that we might need to help you with some anxiety or other mental health issues, let us know, because your mental health is as important as your pap smear. But anyway, this is my weekly check-in with you, and I hope to talk to you later. Have a good day.